Grandma, why do you smell funny sometimes? Mom says it's just your scent. That simple comment struck Nancy Miller, a vibrant 68-year-old, like a thunderbolt. She'd always taken pride in her cleanliness, yet her granddaughter seemed reluctant to get close, even wrinkling her nose when offered a hug. That night, she retreated under her covers heartbroken. Hello, I'm Dr. Henry Thompson, a geriatric specialist with over 5 decades of experience helping seniors thrive. Today, I want to address something that might be uncomfortable, something others might avoid mentioning directly. Have you ever noticed an empty seat beside you on the bus? Perhaps your grandchild seems hesitant to cuddle close, or your daughter-in-law insists on opening windows when you're around. It's the smell of aging, and it's more common than you think. After years of working with seniors, I've observed that this distinct odor is often imperceptible to the individuals themselves, yet noticeable to those around them. Sadly, families often hesitate to bring it up, leaving seniors unaware. Let me tell you about George Carter. He was meticulous about his hygiene, showering daily and maintaining a spotless home. But one afternoon, his son brought friends over, and George overheard one of them whisper, "Wow, that old man's smell is strong." Devastated, George began to withdraw, rarely leaving his room when his grandkids visited. If you're listening, you might be wondering if this applies to you. Truth is, it very well might. But don't despair. Watch this entire video and I'll reveal a simple, effective solution. Science has proven that our bodies undergo olfactory changes as we age. It's a natural process, not a personal failing. But it's also not something you have to accept. By the end of this video, you'll have the tools to eliminate the scent and stop those whispers behind your back. Imagine a child freely climbing onto a grandparent's lap without hesitation. Betty Davis, the bright 65-year-old, once confided in me, "Dr. Henry, my grandkid won't sit with me anymore. What can I do?" Her eyes were filled with sadness. Today, I'm going to share a key insight I've gained from over 50 years of research in patient care, a secret that has transformed the lives of countless seniors. Amazingly, just 3 minutes spent thoroughly washing 2 specific areas can eliminate up to 90% of the unwanted odor. This method has worked wonders for over 1,000 of my patients, revitalizing their family connections. Don't miss this vital information. Last week, I spoke with Frank Wilson, an energetic 88-year-old. He lamented, "Dr. Henry, I use expensive cologne, but my son still throws open the window when I'm in the room. It hurts, you know." I had to be honest with him. Frank, cologne isn't the answer. It simply masks the underlying odor, creating an even more unpleasant combination. It's like spraying air freshener in a dirty bathroom a circumflex euros. It doesn't address the root cause. Many seniors make this error, attempting to cover up the scent with cologne or deodorant, only to find it exacerbates the problem. The windows open wider and feelings are hurt more deeply. To break this cycle, you need to understand the true source of the smell. Do you know where that old age odor actually comes from? While some might attribute it to infrequent bathing or simply growing older, there's a clear scientific explanation. Understanding this science is the key to eliminating the odor. First, let's talk about sweat. In our youth, we typically sweat about a quart each day. After 60, that amount drops to less than half. You might think, less sweat, less smell, right? But it's actually the opposite. Sweat is a natural cleanser, carrying toxins and waste products away from the body. Less sweat means these toxins remain on your skin, providing nourishment for odor-causing bacteria. Nancy Clark, 71, once asked me, "I barely sweat anymore, so why do I smell?" It's precisely because of that reduced sweating. Robert Evans, 73, shared, "I used to sweat all the time, and I hated it. Now that it's gone, I thought it was a good thing, but it's not." Exactly. The body eliminates waste through sweat. Less sweat equals more buildup on the skin. Second, consider the changes in sebum. Here's a surprising fact: as we age, the composition of sebum, the oily substance produced by our skin, changes. Young sebum and old sebum have different chemical makeups. In older age, sebum contains a compound called 2-nonenal, which is the primary culprit behind the old person smell. After 30 years of research, I've discovered that 2-nonenal levels begin to rise around age 50, peaking around age 70. It's an oxidized fatty acid, almost non-existent in younger individuals, and it's responsible for the distinctive odor. Third, the oral environment shifts. After 60, saliva production can decrease by over 50%. Saliva plays a crucial role in clearing bacteria from the mouth and maintaining a balanced acidity level. Less saliva leads to a dry mouth, bacterial overgrowth, and, consequently, bad breath. Linda Harris, 69, told me my mouth is always dry and I can smell it when I talk. I feel self-conscious around my grandkids and try to keep my distance. It's all because of that lack of saliva. So, despite daily showers, cologne, and mouthwash, the odor persists. Why? Because of these 3 significant changes. But more importantly, there's a solution. The answer lies in targeting the key areas you're likely missing. Skip the rest of this video and you'll continue wasting time and money on ineffective solutions. But the method I'm about to share yields noticeable results within a week. Now, let's delve into the essential, effective steps to eliminate that old age smell. Stick with me until the end, and within a month, you'll witness a transformation in your family's attitude towards you. Dr. Henry, can you truly get rid of that old person smell? Patients often ask me this question. My response is always, yes, but you have to approach it correctly, using methods that no one else has shown you. Take James Parker, 75. When he first came to my clinic, he was dejected, confessing that his grandchildren avoided his room and his son constantly aired it out. However, after 6 months of following my advice, he was beaming. Now, my grandkids sit on my lap again. It's like magic. You, too, can experience this joy. What I'm about to share doesn't require expensive products from pharmacies or hospitals. You can begin implementing these strategies at home, starting today. Here's the method, validated by over 50 years of medical research. 97% of my patients have achieved significant improvements. First rule, drink enough warm water. Water. What does that have to do with it, people ask. Water acts as your body's natural cleanser, flushing out toxins and waste products through urine. Establishing a habit of drinking 1 glass of warm water each morning is particularly effective in reducing old age smell. Margaret Adams, 72, shared, at first, drinking warm water in the morning was difficult, but after a month, I became accustomed to it. Now, I miss it if I don't drink it. My skin feels better, and my grandchild says I smell nice. Aim for 6 glasses daily. If you're struggling to incorporate this habit, try this trick. Drink 1 glass upon waking, 1 before lunch, 1 after lunch, 1 at 3 p.m., 1 before dinner, and 1 before bed. Set specific times and the habit will stick. Note, coffee or tea don't count towards your water intake. Coffee actually dehydrates you, so for every cup of coffee, add an extra glass of water. The second rule, light walks in the sun. I'm old, exercise is hard, many say. Don't worry, I'm not advocating for strenuous workouts. Just 20 minutes of strolling in sunlight can work wonders. Sunlight helps to eliminate harmful bacteria on the skin, and gentle walking promotes sweating, which aids in the removal of toxins. Avoid harsh sunlight by walking before 10:00 a.m. or after 4:00 p.m. when the sun's rays are milder. Fred Taylor shared, my legs initially hurt and I struggled to walk. The doctor suggested starting with just 10 minutes daily. Now I can manage a slow walk, just a little huffing and puffing. The third rule, shower daily with warm water. Winter is cold, daily showers are tough, some folks say. But bathing is crucial for removing dirt, oil, and bacteria from the skin. One tip, avoid using scalding hot water, as it can damage your skin's protective layer, exacerbating the odor. Warm water, between 100 and 104 degrees Fahrenheit, is ideal. Once a week, consider soaking in a 100-degree Fahrenheit bath for 20 minutes. This opens up the pores, allowing for a deeper cleansing. Many patients report that the skin feels softer and their odor is significantly reduced after these soaks. Stick to these 3 basic rules, and the old age smell will diminish considerably. But wait, here's the biggest secret of all. When showering, focus on thoroughly scrubbing 3 specific areas. 90% of that odor originates from these spots, yet most people either skim over them or completely neglect them. First, skin folds, neck, armpits, under breasts, navel, groin, behind knees, elbows. These creases trap sweat and create a breeding ground for bacteria. Seniors often miss these areas, particularly the back of the neck and behind the ears. Few realize that odor emanates from these areas. Susan Brooks, 66, exclaimed, "Dr. Henry, it's incredible. I've been showering for years, but I've never really scrubbed my armpits and chest like you suggested. The smell has decreased dramatically and my grandchild hugs me now." Simply targeting those folds in the shower can make a world of difference. Use a soft cloth or loofah and scrub gently, avoiding harsh rubbing that could damage the skin. Second, hairy spots, armpits, chest, scalp. Hair traps sweat and sebum, especially on the scalp, which is often overlooked. Massage your scalp thoroughly when shampooing. Tom Harris, 62, shared, "The doctor told me to massage my scalp while washing my hair. I did, and the head odor has significantly decreased. My grandchild even pats my head now." For men, chest and belly hair also require attention. Use soap or body wash, lather well, rinse thoroughly, and dry completely afterward. Third, sweaty spots, feet, between toes, palms. These areas have a high concentration of sweat glands and are particularly prone to odor. Feet, especially when confined in shoes all day, create a bacterial paradise. The odor then wafts upwards, permeating clothing. John Miller, 68, said, "Men, my feet used to stink badly. I started scrubbing between my toes, drying them thoroughly, and then putting on socks. The smell is gone, and my daughter-in-law doesn't grimace when she enters my room anymore. Wash your feet thoroughly, paying close attention to cleaning between the toes, and dry them completely before putting on socks. Use cotton socks, change them daily, and rotate your shoes to allow them to dry out completely. Reaching your back can be tricky, so use a long-handled brush or cloth. Back sweat can soak into shirts, contributing to the odor, so be sure to scrub your back well. When targeting these three areas, use warm, not hot water, as hot water can damage your skin's protective barrier, making the odor worse. Use a mild soap, avoiding strongly scented products." Mary Johnson, 71, shared, "I doubted that such simple steps could make a difference, but I tried it, and it worked like a charm. My grandchild now sits on my lap and watches TV with me. It's so much fun. After showering, moisturize your skin. Dry skin flakes more, which can contribute to odor, especially in the winter months. Consider a weekly soak in a 100-degree Fahrenheit bath for 20 minutes to release deep-seated dirt and oil. Dry off thoroughly and then apply lotion for even better results. If you don't start today, you'll continue to inconvenience those around you, and more importantly, you'll lose your joy and confidence. To avoid lifelong regret, begin now. Scrub those three key areas, and within a week, you'll notice a positive shift in your family's reactions. Next, we'll delve deeper into dietary and lifestyle improvements. Listen closely until the end. Besides washing, what else can I do? Patients often ask that a lot. Yes, food has a significant impact on body odor. It's closely linked to what you consume. Betty Carter, 60, asked, "I've eaten garlic my whole life. Could that be contributing to my smell?" Garlic and other spices might impart a temporary scent, but in the long run, the antioxidants can actually help reduce old age smell. First, eat more antioxidants. It may sound complicated, but it's simple. Antioxidants slow down the aging process. Aging's oxidation process is a key cause of odor, and antioxidants combat it. Tomatoes, apples, strawberries, buckwheat, and brown rice all help to curb aging from the inside out, reducing odor. Red and purple produce are particularly rich in antioxidants. Paul King, 79, shared, "The doctor told me to eat 1 apple and 1 tomato daily. 2 months later, my granddaughter says I don't smell anymore. It's like magic." Garlic, despite its initial scent, can actually help reduce body odor when digested. Its allicin content fights bacteria and oxidants. 1 or 2 cloves daily can boost your health and decrease odor. Second, eat watery fruits and vegetables. Watermelon, pears, and tomatoes help to flush out waste products naturally through urine. Nancy Miller, 68, shared, "I ate half a cucumber and a tomato daily for health reasons. 3 months later, people started telling me I don't smell anymore. If you find it difficult to eat enough produce, try blending a daily smoothie. It can significantly reduce old age smell." Third, maintain good oral hygiene. Brushing your teeth 3 times a day is essential, but it's not enough. Scrape your tongue too. Tongues harbor bacteria, which are the primary cause of bad breath. A toothbrush won't effectively remove this bacteria, so invest in a tongue scraper from the drugstore. They are inexpensive and effective. Scrape your tongue daily to improve your breath quickly. Linda Parker, 73, said, "Scraping my tongue made me gag at first, but I got used to it. Now I can't skip it. My breath feels so much fresher." Sugar-free gum can also boost saliva production, helping to reduce odor. Xylitol-containing gums can also help prevent cavities. Chew gum for 10 minutes after meals to curb mouth odor. Fourth, cut back on coffee and alcohol. Coffee, tea, and alcohol can dehydrate you, worsening odor. Alcohol breaks down in the liver into acetaldehyde, which is then excreted through sweat, creating a distinct and unpleasant odor. George Carter, 71, shared, "I used to drink a bottle of whiskey every day. It turns out that was the problem. I switched to barley tea, and within a month, the smells were down. I love coffee, so I reduced my intake to 1 or 2 cups and added water or barley tea. I also cut back on alcohol. 5th, get enough fiber. Constipation can amplify body odor as chapped waste reabsorbs toxins into the bloodstream, which are then eliminated through the skin. Brown rice, whole grains, produce, and other fiber-rich foods can prevent constipation and keep your gut healthy. Starting your day with brown rice or oats can kickstart your bowels. Margaret Evans, 77, shared, "I've been constipated my whole life. I started eating brown rice and soup for breakfast and it's gone. And surprisingly, my body odor has also decreased." Don't start now and you'll waste money on expensive, ineffective remedies. Simply make a few tweaks to your body and mouth care and you'll notice a significant difference. These habits not only reduce odor, but also promote overall health, contributing to a strong and active old age. Begin now. Next, I'll cover clothing and gear care, and then we'll wrap things up. Listen until the end. Do all of this today, and in 1 month, you'll see a clear shift. Finally, clothing and personal items have a significant impact on old age smell. You may be clean from the shower, but if your shirts or bedding are smelly, it can negate your efforts. Focus on this aspect. First, change your clothes and underwear frequently. Wearing clothes that are soaked with sweat and sebum creates a breeding ground for bacteria, leading to unpleasant odors, especially during hot summers. Change your clothes even more often during these times. Robert Harris, 72, said, "I used to save on laundry and wear clothes for 3 or 4 days. The doctor told me to change them daily. The smells have decreased significantly. Underwear should be changed daily, and cotton is the best choice, as it wicks away sweat and allows your skin to breathe. Synthetic underwear traps sweat, exacerbating the odor. Wash your clothes and dry them in the sun if possible. The sun is a natural bacteria killer. On rainy days, ensure your clothes are completely dry before wearing them. Second, wash your bedding frequently. You spend approximately 8 hours sleeping each night, during which sweat, sebum, and skin flakes accumulate on your pillows and sheets, providing nourishment for odor-causing bacteria. Wash your bedding weekly and dry it in the sun if possible. Pillowcases, in particular, should be changed more often as they collect head oil and flakes. Linda Parker, 75, shared, "I used to wash my sheets monthly. The doctor said to do it weekly, which seemed like a hassle at first, but now it's routine, and my room smells so much fresher. Old pillows and blankets should be replaced every year or 2, as bacteria and mites can build up within them, contributing to odor. Third, care for your shoes and socks. Foot odor can seep into your shoes and socks, affecting your overall scent. Change your socks daily and opt for cotton socks, as they are the most breathable. Avoid wearing the same pair of shoes every day. Rotate between 2 or 3 pairs to allow them to dry out completely between wearings. Sprinkle baking soda inside your shoes to absorb odor." Paul King, 69, shared, "I used to wear the same pair of shoes forever. The doctor told me to switch to wearing different pairs and to change my socks daily. My foot odor has decreased significantly, and my grandchild doesn't wrinkle their nose when they're in my room now." Fourth, air out your rooms frequently. Stale air can contribute to odor. Open windows twice daily, in the morning and at night, for approximately 10 minutes each time. This will allow fresh air to circulate and clear out any lingering odors. Bathrooms and kitchens tend to accumulate more odors, so ventilate them even more frequently. Placing a small bowl of baking soda in the bathroom can also help to absorb odors. Fred Taylor, 71, said, "I hated the cold and rarely opened windows. The doctor told me to do it twice daily. It was chilly and annoying at first, but the air is so different now, and my daughter-in-law doesn't find them open anymore." Here's a summary. Old age smell comes from less sweat trapping dirt and grime, oxidized sebum producing tuna-nil, decreased saliva causing dry mouth, poor diet, inadequate hygiene, insufficient water intake, and neglected clothing and bedding. The solutions are: drink over 6 cups of warm water daily, walk for 20 minutes in mild sunlight, scrub 3 key areas thoroughly, folds, hairy areas, and sweaty parts, consume antioxidants from produce and garlic, maintain good oral hygiene with brushing and tongue scraping, wash clothes and bedding frequently and wear daily, sheets weekly, and air out rooms twice daily for 10 minutes each time. This costs next to nothing. There are no expensive products or complex steps required, just daily care tweaks. Eliminating old age smell isn't just about odor, it's about making small changes for a healthier, more confident life. These changes can strengthen family ties, enhance your social life, and, most importantly, boost your self-assurance. Don't let odor isolate you from others, prevent you from spending time with your grandchildren, or leave you feeling lonely. Margaret Adams, 62, shared, after following the doctor's tips for 6 months, my grandchild now sits on my lap to watch TV, hugs me, and kisses me. Thank you, Dr. Henry, for giving me back this joy. You, too, can experience this joy. Well, folks, that's it for today's deep dive into tackling the old age smell and reclaiming your confidence. I hope you found these tips insightful and practical. So tell me, what's one thing you've learned today? Maybe it's scrubbing those key spots, drinking more water, or airing out your room. Whatever it is, share it in the comments below this video. I'd love to hear what you're taking away and incorporating into your daily life. If you found this video helpful and want more content to improve your quality of life, leave a comment below and don't forget to share this video with other seniors who need it.